Trillium is a behavioral health provider for kids and families in the state of Oregon. We have programs that serve all different levels of care.
Outpatient, intensive outpatient, and prevention, and then day treatment, which is basically therapeutic school, and then psychiatric residential treatment services.
Our goal is to kind of take them in and welcome everybody with open arms. We're here to provide the best mental health services that we can.
Doing this work, there are a lot of kids that come in with a lot of trauma and behavioral issues, and the way that that can manifest in the units is aggression and violence and just really difficult situations, difficult for the kids and the whole team.
We typically experience a lot of injuries just in the nature of the work that we do, burnout, turnover with that as well, and overall a lack of feeling safe.
We've been working with SAIF for a long time, and so they proposed this sort of program, the Workplace Health and Safety Program, and said, "Is this something you want to try out?" And we're, as an agency, very much like, let's try anything. And then we put together a group of people who were mostly our direct care staff, and then we looked at the root cause of what we sort of really unpacked what is leading to workplace violence.
We got together, people got involved. It was super inviting and welcoming. We could advocate for these things, and we could speak our mind, and we could look towards some action items and improvements rather than here's where we're at, here are our concerns, but where do we start?
It really navigated the conversation of what are we feeling, what are the struggles that we're having, really digging into those with the staff feeling that way, and then problem solving.
I was really excited about kind of taking that bigger picture lens look at what was going on, trying to figure out what those root issues were and what we could do from an agency level to make this a safer and healthier place to work.
Roadblocks for the group itself, I think, was just the attendance piece. It can be difficult to get folks off of the floor and into a meeting just because we were having the direct care staff be a major part of the meeting.
We've had some pretty substantial wage increases, which was one of the, not even the most important of the interventions, but one of the interventions.
We've revamped our academy training, so all of our new staff that come in go through a week-long 40-hour training before they get onto the floor, before they're in the unit with the kids. We've really changed the structure of that, and it's more hands-on. There's a lot more practice in the physical interventions. There's a lot more practice in the verbal interventions.
We've tried to change some of our structure around staffing, around supervision. We've changed a little bit of our management structure within the programs to better support supervision for staff, which better supports staff, like when they feel connected to their manager.
I do feel like there's been a change in culture, and I feel like our approach to working with the kids in crisis has shifted significantly. In this last year or so, the use of manual holds has dropped significantly. We're not seeing nearly as much physical intervention. Morale has gone up with our staff. There's more passion, there's more patience, there's less burnout.
In reflecting back on this process and the impact that it's had, one of the neatest things for me was knowing that the work from the work group went to leadership and was seen and heard and embraced as a real product of the workforce and the people who are most impacted by the risks that come with this job. And leadership was incredibly welcoming to the feedback and basically said, whatever you want to do, we want to put the resources behind it.
Somebody in my role considering the program, I think just really going in with an open mind, active listening, taking a step back and allowing the process to occur without trying to navigate it as much, and that can be difficult for sure.
Everybody's voice is so important. It is incredibly important to engage folks who are doing the work on the front line and intimately aware of the difficulties that they are facing, to be engaged in coming up with solutions to the issues that they're facing.
In our field, like, it can be so easy to just be putting out the fires, and you're managing this problem as it comes up, and then you're managing this problem as it comes up, and it can be so hard to find the space to be looking, just to be constantly moving towards the future. And I think that one of the things that this program and presenting the information to our management team is, like, it's really sort of kept this narrative in the space too. So it's not just putting out problems, but it's pulling back into, but here's why we're doing this. Here's where we need to be moving. How do we keep moving even when the job is hard and staffing is low and it's hard to hire and it's hard to recruit, and we got a new kid that's really hard, right? Like, all these things that are the day-to-day life of our direct care managers, but also their job is to keep us moving forward too. And so, yeah, I think that these conversations happen a little bit more organically and a little bit more proactively. If you're ready to engage and wrestle in this process, you want to come open-minded, right? You want to come ready to say, I'm willing to hear whatever you're thinking in a non-defensive way.